Hi, my name is Dr. Karl Yousef, and I'm here to break down what to expect in the emergency department when you come in with a rash. I'll walk you through certain things your doctor may be thinking about, and afterwards, I'll explain certain labs or imaging that you might receive. Depending on the complaint, we'll finish with some potential outcomes to expect if your doctor sends you home. Remember, in the emergency department, we don't just look for what is going on, we look for what isn't going on. What does this mean? It means that as emergency doctors, we always have a mental list of scary diagnoses that we have to make sure are not happening to you. So, even if we don't find the exact diagnosis within one ER visit, our goal is always to rule out big, bad, and scary things. As you go through your workup, remember that even if you don't see your doctor for some time, they are always following your results in the background. So, you're coming into the emergency room with a rash. When you come into the ER with a rash, your doctor is usually thinking about some key diagnoses that they want to make sure are not happening. There are many causes of rashes, and the story you give your doctor will be very important in helping your doctor rule out dangerous diagnoses. Your doctor may be thinking of anything from anaphylaxis, which is a severe allergic reaction, to milder allergic conditions. They will also likely consider other causes such as infections of the skin, which can be bacterial, fungal, or even from a virus. Your doctor is also considering reactions to medications that can sometimes be incredibly severe. Beyond that, your doctor is also thinking about environmental causes and autoimmune causes. These are just a few possibilities that your doctor is considering, but they are also thinking about many other reasons for your skin rash. Depending on your symptoms and story, your doctor may get blood work, but this is not always necessary. Your doctor may very quickly identify the cause of the rash, but in certain cases, it can be difficult, and your doctor may run more tests, such as obtaining blood work. After some time, your doctor will explain your results to you. If your doctor is recommending that you stay in the hospital, it could be for additional monitoring, or it could be that your doctor found something that needs extra attention. In either case, your doctor will explain to you the reason for keeping you in the hospital. Finally, if your symptoms improve and you're being sent home, I'm happy to hear that. Make sure to follow your doctor's recommendations, and if your symptoms are not improving or are getting worse at home, we always encourage you to come back to the emergency department to make sure nothing was missed on the first visit. If your doctor is allowing you to go home, they likely ruled out what we call emergent diagnoses. These are conditions that we consider to be life-threatening with severe consequences. However, your doctor may not have given you a direct reason for your rash. That is okay. And please remember that in the emergency room, the goal is to rule out severe causes. Oftentimes, rashes may require the expertise of a dermatologist. This is a doctor who specializes in diseases of the skin. If your emergency doctor is unable to identify the cause, it may require a dermatologist who is often able to take a sample of the rash, called a biopsy, and send it to a lab for verification. That is not a luxury that is present in the emergency room. Your doctor will also advise you that if things are getting worse, that coming back into the emergency room immediately is very important. I know that being in the emergency department can be an incredibly stressful experience, and I hope this is helpful for you. Again, this is Dr. Karl Yousef. Wherever you are, we care about you. We work hard to make sure that you're okay. While you wait, feel free to subscribe to this channel for more medical information from a board-certified emergency doctor. You can comment with video ideas that you want me to cover, and I'll take the time to reply to you. You can even watch some of the other videos on this channel for entertainment. Thank you for your time. I'm wishing you the best in your health.